Hello everyone, my name is Jennifer Kyatt. I am a registered dental hygienist and I'm here today to give a dental professional's perspective on gummy vitamins. Now, my personal opinion on vitamins has always been that you should talk to your physician and find out exactly what it is that you should be taking. Find out if you are deficient in anything. It's not the best idea to talk to Karen down the street and decide that you should be taking vitamin D also. So have your physician tell you what you need to take and if there's any other vitamins that would go along with it to help them work properly. As a parent, I am aware of the concern about our little ones getting everything that they need. Maybe not eating all of their vegetables, maybe not getting enough dairy. They're on the chicken nugget and ketchup diet. So that is a concern, and I think that's a lot of times where the gummy vitamins come into play. Nowadays, there are several different ways to take vitamins. They come in a lot of different forms. A lot of people my age grew up on the chalky, chewable vitamins, and that is still an option. And then, of course, there are the capsules that you just swallow. There are the gummy vitamins. There's dissolvables, and then some even come in a liquid that you use a dropper, and a lot of times that goes under your tongue or sublingual. So there's several different ways to get vitamins nowadays. There's a few things that I do take that I have here, and we'll look at the ingredient labels for those. But I take B12 in the morning to give me a little bit of energy, and then melatonin at night to help me go to sleep. So for my B12 that I take, I do have a dissolvable and I have a gummy. So I have the both options that I can take. Now, if we look at the label on the dissolvable, it does not show any sugars. It does not show any carbs. If we look at the ingredients list, there's nothing on here that screams sugar to me. Something like sucrose, glucose, different things like that. It has beet juice, cherry flavor, vegetable stearate. So this is one lozenge is a serving, and it does not have any sugars as far as I can tell on this label. Now, looking at the gummies, and I'll try to show this to you. I'm not sure if you'll be able to see it, but one of the first ingredients is tapioca syrup, and then sucrose is second, and then we have the gelatin and other things. And you would need one serving is 2 of these vitamins. But we have sugars is in there, carbs is in there, and we have 3 grams of both of those. So the concern with the gummy vitamins having the sugar in it is you're gonna chew it up and it's gonna be sticky and it's gonna stick into the biting surfaces of your teeth. Now, when it comes to getting cavities, it's not necessarily the amount of sugar that you're ingesting daily. A lot of times it's the duration of sugar. How long is sugar coating your teeth? That bacteria will be constantly having a food source. So with the gummy vitamins, it's going to stick to your teeth and stay there and be coating your teeth in that sugar until it's cleaned off or brushed off, ideally. And then also, if you're taking these in the morning like I am, and then you eat a sugary cereal or a toaster pastry or something else that has sugar, then it's going to stick to your gummy vitamin and add more sugar to that. Now, with the dissolvable, it goes away fairly quickly. It is not going to be constantly bathing your teeth. I would assume the same thing for a liquid. Obviously, if you're taking a pill, it's not going to coat your teeth with really anything. And I wish I had some of the chalky chewables, but I don't have any to show those. I do feel there's probably, some of them have sugar. But same thing, I don't think it's going to stick to the teeth as long. Now, looking at my melatonin, the one I take at night, same thing on the ingredients, does not list any sugars, does not list any carbs. As I go through beetroot again, I don't see any of those ingredients that's gonna scream sugar to me. But as a dental professional, I'm gonna try to show you this. That might be a little harder to see. That ingredient right there, that's xylitol. Now, as a dental professional, we get very excited about xylitol. So for those of you that don't know, xylitol is a natural sweetener that mimics sugar, but it's not sugar. So the bacteria try to eat the xylitol and then they die because they're not getting the nutrients they need. So the xylitol in your vitamins is actually going to be beneficial in two ways. It's going to help you, and then it's also going to help your mouth because it's going to kill that bacteria, hopefully prevent cavities, and help with freshening your breath. Side note, that is poisonous to dogs, so don't let your dogs get into it. But as a dental professional, that's very exciting. So, a few things that I hope that you take away from this when you're looking for your vitamins or thinking about taking a vitamin is, number one, talk to your doctor. Talk to your physician, find out what you need to take, find out what your child needs to take, and the best ways to take them. But do what's best for you. If your kid is not eating their vegetables and you know they're not growing like they need to be and your physician is concerned and the only way that you can get them to take their vitamins is a gummy, then so be it, take a gummy. But please brush your teeth afterwards. So maybe taking your gummy vitamins at night, brushing your teeth right before bed, and that would kind of eliminate the sugar constantly being on your teeth all day. Now, the second thing that I would like you to be aware of is knowing your labels. Read your labels. Look for sugars. A lot of them on the front will have big writing saying no high fructose corn syrup. They'll tell you what's not in there. They'll kind of get you with that front label, but check your back labels. Read the ingredients, know what the ingredients mean, know the different verbiage for what sugar is, and pay attention to that. And then thirdly, see your dentist. Go see your dentist regularly. I can't stress it enough. It's a lot easier and less expensive and less stressful to find a tooth issue early on, take care of it early on. If we see that you're getting cavities often, then we can make recommendations like, hey, what are you doing? What's going on? Why are we getting all these cavities? And what can we do? Can we take a tooth vitamin, fluoride? Do we need to supplement something like that and get help in that area? Now, if there's any dental professionals that are watching this video, talk to your patients. When you're going through your health history and they tell you they're taking a vitamin, they're taking a multivitamin, B12, vitamin D, ask them how they're taking it. Ask them if they're taking a gummy vitamin. Do they know what's in it? Have they been told by a physician to take that? So educate them as well and make sure that they know that, you know, they could have some issues from those vitamins if that's what they are taking. Now, I hope you've all learned something today. I hope this was helpful. And finally, don't forget to floss.